is Dan Dumas. I've been an employee for 33 years with American Crystal Sugar in the Hillsboro factory. I've served in every aspect of the operation from maintenance to process, currently employed as a sugar boiler. I'm here today to speak on one thing for us, healthcare. I being an employee from 81 to 83 is the last cost of living raise that we had to maintain the healthcare that we have today. The company wants to take and change it. In doing so, they're not telling what we call the whole truth in the program, and I want to get to that. While I was heading on Sunday to have breakfast with some friends, a man approached me that I know as an acquaintance, but I don't really know him. He looked at me and he goes, "What the hell is wrong with you guys?" Not really knowing him, I listened, goes, "What the hell is wrong with you?" I said, "I don't understand. Why wouldn't you take what they're giving you?" I knew him by name, Harold. I said, "Harold, can I ask you something? Have you ever leased a vehicle in your lifetime?" He goes, "Oh yeah?" I said, "If you lease that vehicle for $250 and you could drive it 6,000 miles a year, you knew what you had, right?" "Well, yeah." I said, "What would you do if they said, we can raise that monthly payment and lower the mileage at any time? Would you lease that vehicle?" He goes, "Well, that would be bull crap." He goes, "Is that what they're doing to you?" I said, "Yes, they're not telling the whole truth." Not only this 87% and the 13 they want to do is taking us from a $450 copay for family, $8 prescription pay, they want to go to $4,800, kick in an HSA. They're not telling the whole truth. Tell it that a month later they can make us pay $600 a month and raise our deductible. It's bull crap. Yep. This is really personal to me, and I had a really hard time getting through this, so I left it more towards the end. This is my daughter, Kayla. December 26, 2007, she was returning home from college. She went to her grandfather's house with her mother, her brother, and her stepdad in a vehicle. Somebody blew through a stop sign at a rate of about 60 miles an hour and T-boned her. She was in a coma for 3 months. We sat by her side. With good friends at Crystal, I'll say lower management in the factories, along with you union people, in my 6 weeks vacation, I stayed by her side for 3 months. I didn't leave her bedside. Kayla's went through a lot. She went from Medicare here to Bethesda Hospital in Minneapolis, back to Dakota Alpha out in Bismarck. At the time she was there, gas was in excess of $4. My days off, we drove out there 3 to 4 times a week to be with her. Right now, Crystal Sugar, Mr. David Berg, our CEO, singled me out in the factory. "Dan, my wife and I pray for your daughter." Nice way of showing it, huh? Right now, she's in therapy. My daughter, Kayla, please stand up. She's a miracle. She wasn't supposed to live. She's back in college. Kayla has beat every odd. And the people that were with me at my meeting with the senators, staff, and there wasn't a dry eye in the room. It took me 2 times to get through it. And Kayla was signing up for college at MSUM today. She was supposed to just be vocational rehab. She wasn't supposed to be out of a nursing home living in a wheelchair. Last semester, she had a 3.83 GPA. She is beating the odds. With her by my side, I can get through this and talk to you without breaking down like I did before. The effect that we are having right now, as we know, insurance-driven programs, Kayla is in a therapy session at Stanford Health. You have to completely meet criteria, passing tests, to be able to achieve further therapy. She's gotten to that point now, and she's been cut off. Because of what? Corporate greed? Corporate greed! So what we're asking for is end this lockout. Let the people do what they need to do. Let us go to work. Let us do our thing. And in ending, what I want to say is I'm not the only one. I feel for the other people there. Another co-worker, his wife has cancer, not doing well. It's tough. Another person today, we just found out he may lose a son because of no insurance. He's in Bismarck. He's been there for 8 months, and without insurance, the state may take custody of him. And being there, driving to Bismarck, I know what they're through. For the co-worker whose wife has cancer, my grandchildren lost their grandpa 3 weeks ago to a lung disease, working in a meat plant, walking in and out of cold situations in a workforce that we give our life to do that job. Their other grandma diagnosed with cancer now, we don't know what to do, so I feel for them as we're going through it. In closing, I have one thing to say. There are 7 deadly sins, one of them being greed. The people that incorporate this, from the farmers, the upper CEO levels, when they look in the mirror at night, if they like who they look and can go to bed with that, I would rather go away broke and have my dignity. Thank you. Yeah.